Let's talk about when to worry about your ovarian cyst. I get this question all the time with patients, whether they're worried that it might be cancerous or they might need surgery, or is this cyst causing pain? Again, this is going to be a multi-video series, so stay tuned. My name is Eric Schmidt, board-certified OBGYN minimally invasive gynecologic surgeon. Again, we're doing a fundraiser down below in the link. There's a description, or in the description, there's a GoFundMe link for gynecologic cancer research. And so we're trying to build awareness for that since September is Gynecologic Cancer Awareness Month. So please donate if you can. In this specific video, we're answering the question, well, should I be worried about my cyst being cancerous or having malignant potential? And there's a few ways we evaluate this. Number one, if you discovered you had a cyst, you likely had imaging done, whether you had symptoms or not, or was found incidentally with an MRI, CT scan done for a different reason. But now we found the cyst. And we look at it with ultrasound is usually the best way to classify the cyst, and we have a specific ranking system. It's called ORADS. ORADS 1 to 5, 1 being the least concerning, 5 being the most concerning for malignancy. And so often cysts we find are usually around ORADS 1, but sometimes if they're elevated ORADS, meaning the cysts have things in them, and this can be like abnormal blood flow, this can be septations, calcifications, nodules in the cysts, that might elevate someone's ORAD score, make us want to do the next step, which is labs. If someone is suspicious for having a potential malignancy of an ovarian cyst, we might want to do what's called a CA125 blood test. The CA125 blood test is a specific protein that can be released by the ovaries if there is a potential ovarian cancer. However, there are other things that are benign that can cause these CA125s to be elevated, so it's not a perfect test. And so again, we might get these blood tests for someone that has an increasingly suspicious ovarian cyst, or maybe someone that has postmenopausal and they developed a new cyst. At the end of the day, most cysts in premenopausal and postmenopausal women are benign. And I want to give some reassurance, but it does warrant investigation if you potentially have found you have an ovarian cyst. Especially in premenopausal women, they are quite common and likely will improve and go away on their own, but we'll talk about that more in the next videos. But sometimes if there is suspicion, or if someone wants to truly find out if their cyst is dangerous in any way, we would need to do surgery. There's no good way to biopsy these ovarian cysts because we don't want them to spill in other parts of the abdomen. And so potential surgery is really the only truly way we can know whether or not ovarian cysts are worrisome. But again, most cysts are benign. Hope you enjoyed this video. We'll talk to you soon.